This review had analyzed 137 studies, mostly from high-income European and Asian countries. You are calling it problematic. Can you tell me what's wrong with it? What's right with it?
Ashley, there's very little right with it and plenty wrong with it, and I'm happy to unpack that. The first is that the data was collected prematurely. It was pre-pandemic, 2018 and 19, but what they call pandemic is really early 2020. We know that the human brain can sustain and adapt to short-term stress quite well, but over long periods of time with chronic stress, that's when mental health challenges can really crop up. And that has not been captured in this study. As you reported, 137 studies in this one systematic review, really comparing apples to oranges, as the authors have alluded to, a high risk of bias, lots of differentials within the groups, and a risk and caution in interpreting the results. And finally, the data really looked predominantly at high-income countries. 77% of those studied were in high-income countries and 20% in middle-income countries. So when you really look at what's happening with this study, it does three things. The first is that it really perpetuates this idea of toxic resilience, that the more resilient you are, the less mental health issues you have, and we know that that has been debunked by the science. Resilience is not enough to protect against mental health. The second thing that it really does is that it perpetuates and really gaslights the millions and hundreds of millions of people who have had this experience of mental health struggles. And finally, this study could have vast policy implications in terms of funding for mental health programs. We need more attention for mental health, not less at this time.